It's 6:20 in the morning. You're half awake. Your brain is chanting one word, coffee. Now, plot twist. Your new weight loss pill looks you in the soul and says, not yet. We need 30 minutes alone with water. Welcome to 2026, where Wegovy is now a tablet, needle-free, but it's not rule-free. Today we're doing the great trade, the weekly shot versus the daily pill. Not which one is better online, which one fits real humans with real mornings and real habits. Quick note, this is education, not personal medical advice. Talk with your clinician before starting or switching any GLP-1 medication. And one more thing, as an obesity medicine doctor, most of my patients have been successful with weight loss by simply going low-carb, keto, or carnivore. But the reality is, there are some people who need help, and that's why I made this video. All right, 5 rounds, scoreboard style. And I'll drop lesser-known facts that most influencers won't mention. Fast, clear, and practical for you. Round 1, let's talk about convenience. Weekly shot, once a week, any time of day, with or without meals. Daily pill, once a day, but it comes with terms and conditions. FDA label rules in human language. Empty stomach, morning, water only up to 4 ounces. Swallow whole, then wait at least 30 minutes before food, drinks, or other oral meds. Lesser known fact. The tablet includes an absorption helper called saccharose sodium, abbreviated NAAC. Score. Shot gets round 1 for pure convenience. Shot 1, pill 0. Round 2, compliance. Will it actually do this? The coffee test. Can you delay coffee for 30 minutes most mornings? If yes, the pill may fit. If your coffee is basically your therapist, the weekly shot may be your peace treaty. Lesser known fact. The pill has a 3-month ramp to maintenance. Day 1 through 30, 1.5 milligrams. 31 through 60, 4 milligrams. 61 through 90, 9 milligrams. And 91 plus 25 milligrams daily. So if you're the type who loves a clean morning routine, this can work beautifully. If you're the type who wakes up already late, this can feel like trying to assemble IKEA furniture in the dark. Score. Tie. Shot 1, pill 1. Round 3. Let's talk about effectiveness. Does it work? Yes. In the New England Journal of Medicine trial report, weight change at 64 weeks was about 13.6% with oral semaglutide versus 2.2% with placebo. Let me make that real. If someone weighs 250 pounds, 13.6% is about 34 pounds. That's not I skipped dessert twice. That's biology is changing. And summaries of the same program note that with strong adherence, averages and big loss percentages can look even better. Lesser known fact. The FDA label notes that 25 milligram tablet can produce average blood concentrations comparable to the 2.4 milligram weekly injection, but with higher variability person to person. Translation, 2 people can take the same pill, and their bodies can see it differently. That's why follow-up matters. Score. Tie. Shot 2, pill 2. Let's go to round 4, where we talk about side effects. Most people know the headline. GI side effects, including nausea, constipation, diarrhea, stomach discomfort, can happen with GLP-1's pill or shot. Lesser known fact. A lot of side effects are dose plus behavior. Big portions, greasy meals, alcohol, eating fast can turn mild nausea into a full-time job. So here's my side effect survival kit for week 1 through week 12. Smaller meals, slower eating, protein first, and don't let hydration slip, especially if nausea or diarrhea show up. Also, strength training matters because the goal isn't just less weight, it's less fat while protecting muscle. Now the serious warnings matter too. The label includes warnings like pancreatitis, gallbladder disease, dehydration-related kidney injury, and a box warning about thyroid C-cell tumors with contraindications in people with personal or family history of medullary thyroid carcinoma or MEN2. Score. Tie again. Shot 3, pill 3. Round 5. Cost and coverage. The wallet round. Here's what's been reported around the US launch. Cash pay pricing has been discussed publicly as about $149 a month for starter dosages, that's 1.5 and 4 milligrams, and about $299 a month for higher dosages, that's 9 and 25 milligrams, with some planned price changes for 4 milligrams later. And for eligible insured patients, savings programs may lower out-of-pocket costs. Lesser known fact, the real cost is what happens if access changes. So even if you're using medication, you still want a plan that includes sleep, stress management, protein, movement, and fewer ultra-processed foods, because that's how you protect your results long-term. Score depends. Final score: shot 3, pill 3. No universal winner, only best fit. Here are some commonly asked questions and some quick answers. Is the pill the same as the shot? Same active ingredient? Yes, semaglutide. Different delivery method. Can I take it whenever I want? No. For the pill, we need an empty stomach, morning, water up to 4 ounces, swallow whole, and then wait 30 minutes before anything else by mouth. Can I crush it? No. Swallow whole. Don't split, crush, chew, or dissolve. What if I miss a dose? You skip it and take the next dose the following day. No double dosing. How long until full dose? Maintenance starts day 91 and onward, about 3 months. Can I switch from shot to pill? Label guidance exists. If you're on Wegovy 2.4 milligram injection, the label describes switching to 25 milligram tablets starting 1 week after stopping the injection. Can I switch from pill to shot? Also yes. The label describes starting injection the day after stopping 25 milligram tablets. And if tablets weren't tolerated, considering 1.7 milligram injection. Who should not take it? Talk with your clinician. But the label includes contraindications like personal family history of medullary thyroid carcinoma or MEN2. Is a daily pill automatically easier? Not always. Daily is easier for needle fear. Weekly can be easier for consistent follow-through. That's the trade. Who should consider which? If you're a routine rock star, you'll probably do fine with the pill because you'll actually take it correctly. If you're a chaos morning champion, the shot may fit better because it's once weekly, anytime with or without meals. If you're a morning med stacker, thyroid meds, osteoporosis meds, multiple morning prescriptions, the pill's 30-minute waiting rule can turn into a scheduling puzzle. That doesn't mean no. It means plan the timing with your clinician and pharmacist so medications aren't competing. Myth versus reality lightning round. Myth: a pill is always easier. Reality: easier on needles, harder on rules. Myth: oral must be weaker. Reality: trial results show meaningful weight loss. Myth: if I stop, the results are permanent. Reality: most people need a maintenance strategy, because obesity is chronic, and it deserves chronic thinking. Here's my simple clinician checklist. What's my target dose and timeline? What's my nausea plan? How will we protect muscle while weight comes off? What's the plan if coverage changes? And what does maintenance look like for me? Because as a root cause doc, here's the big message. These meds can quiet the noise. But if the environment stays loud, ultra-processed foods, poor sleep, high stress, low movement, your biology will eventually find the volume knob again. So if you want more videos like this, check the playlist and the description for more metabolic health content. And comment, pill if needles are your deal breaker, or shot if your mornings are chaos. And tell me your biggest question, because weight loss isn't the goal. Fat loss is. I'll see you in the next video.